Hi, I'm Dr. Alex Keeble.
Hi, I'm Dr. Allison Owen from the Center for Muscle Biology here at the University of Kentucky. Alex, do you want to talk to us a little bit about what our group works on?
I'd love to. So our work seeks to identify novel effectors to enhance muscle recovery following traumatic joint injury. We predominantly work with patients who have unfortunately sustained knee injuries, specifically injuries to the anterior cruciate ligament or the ACL. Our work involves studying tissue samples from those patients through the application of various omics approaches to identify unique signatures that may predict patient recovery following this horrible injury. We then reverse translate those findings from our clinical work with the use of preclinical animal models to mechanistically interrogate potential factors from our patient samples. Our ultimate goal is to leverage genetic and pharmacologic approaches to hopefully validate our clinical findings and identify targetable factors that might facilitate improved recovery following joint injury. Now, Allison, would you mind taking a minute to explain what our study investigated and found?
Absolutely. So prior work from our research group has identified that induction of colony-stimulating factor 1 receptor, or CSF1-R, was positively associated with knee trauma severity and could represent a prognostic marker for posttraumatic osteoarthritis, or PTOA, following an ACL injury. So we hypothesized that CSF1R was a critical component to the initial acute inflammatory state following a joint injury that would lead to suppression of muscle recovery and degradation of the articular cartilage. So to investigate this research question, we performed transcriptomic and histomorphological analyses of skeletal muscle and articular cartilage following direct joint injury in a murine model where animals received either a CSF1R inhibitor or a vehicle control. So from these studies, we found that CSF1R inhibition mitigated muscle atrophy and attenuated PTOA severity and synovitis. Further, we found that patient synovial fluid CSF1R levels correlated with matrix metalloproteinases that degrade articular cartilage.
These findings are actually very clinically significant. They support an opportunity for CSF1R targeting to mitigate PTOA severity and muscle atrophy after acute joint injury. The combination of Noehren and patient samples support the translational relevance of our work, and recent FDA approval of CSF1R inhibitors offer an additional support for future investigation.
Awesome. So thank you all for taking a few minutes to learn more about our study, which was published in the Journal of Physiology. The full paper was published in volume 603, issue 23. Please contact Dr. Christopher Fry at CFR223 at uky.edu with any questions. Thank you.
Thank you.